Wednesday. As you know, it is Hospital Week. We figured we'd hit a little differently today and show you one of our newest areas in the hospital. It's our hybrid operating suite, where some of our cardiologists and cardiovascular surgeons do some work. So we'll get into that in a minute, but we have Lee here.
We're dressed differently today, Sarah.
Yes, we
So
are.
in this room, we have to wear these official scrubs for safety reasons, being safe. And actually, Josie was going to let me interview for a scrub tech job, but I didn't qualify. So anyway, but we are here today because we want to interview some of our great cardiologists, and we'll get to that in a second. But first, the statistics for today. I'm very happy to report to you that we have 0 positive COVID patients tested today. So that's really good. I think that continues to show that we're on the right track and the trend is going good. But again, like Sarah said, we want to focus today a little bit and start shifting gears, getting back to normal.
Yes, because heart attacks and strokes do not stop no matter what's going on around the world. And that's why we have this awesome room and awesome interventional cardiologists here with us. They're going to explain a little bit about why we have invested in this technology.
Exactly. So a while back, not too long ago, time flies, it was actually almost 4 years ago, when the structural heart programs were sort of being born in the world, Dr. Zaya, one of the cardiologists, gave a presentation to our board about it and said this is the future, and our board and management team and the other cardiologists felt like this is something that we should really focus on and try to figure out a way to invest in. With a lot of work and deliberations by a lot of people ranging from facilities to finance to the doctors, this room became a reality. And so here we are today, many procedures later, with 2 of these rock star physicians that we'd like to ask a few questions of. So
yes.
Sarah, why don't you see what we can stump the cardiologists on?
We have Dr. Cunningham and Dr. Ediz Tasan. And Dr. Cunningham, you're from Van Cleve and came back down here to be here on the coast and provide excellent care. What made you want to be an interventional cardiologist?
I think the main thing to be an interventional cardiologist is just, I think, first off, if you're going to be a doctor, you got to care about the community you're serving. And secondly, I think it's a procedural-based specialty, and I think many doctors and surgeons will tell you, procedures are enjoyable, and you see instant outcomes for your patients often. And so I think that really kind of what drove me to this particular specialty and then subspecialty of interventional cardiology.
Thank you. And Dr. Tasan, what is the structural heart program? What does it actually mean?
Basically, it means a gamut of procedures that we can perform through the leg, and would not require a sternotomy in the layman terms, an incision in the chest and opening up the chest. These procedures have really revolutionized the way that we are able to tackle some of our higher risk patients and inoperable patients who would not have the most favorable long-term outcomes in 1 to 2 years, and give them kind of a second lease on their lives and improve their symptoms dramatically.
So how many of these, Dr. Cunningham, how many of these types of procedures have you guys performed roughly? And remind me again, name the different types of structural heart procedures again.
Right, so we do TAVR, which is transaortic valve replacement, which is an aortic valve that's placed through the groin, or various other access sites without having to cut your chest open. We do ASD and PFO closures, which are closing a hole in the heart, either to prevent heart failure or, in the case of PFO, sometimes prevent strokes. And then mitral clip is a clip-based procedure to repair the mitral valve done through groin venous access, also to prevent a patient who's too high risk to have surgery from having to have their chest cut open. And then lastly, the Watchman Device, which is kind of the newer technology, maybe the newest, actually maybe the oldest, but the newest in terms of becoming a rapidly adopted technology in the field of cardiology. It's actually been around for quite some time, over a decade, but it's now becoming rapidly adopted into clinical practice because of recent trial data and registry data that shows how effective it is.
Cool. What is this right here? What do you got right there?
Yeah, so this is a Watchman Device. This is, you can see it looks kind of like a jellyfish or a parachute. And so it's got a nitinol metal frame, which means nitinol just means it's self-expanding, so it can be squished inside of a sheath and deployed inside of what's called the left atrial appendage, which we know is where 90 to 95% of the strokes caused by atrial fibrillation come from. And atrial fibrillation is the most common cause of stroke in the country. And so this device is there to prevent, it is implanted through the groin by venous access. It takes about 30 minutes to put the device in. It closes off the appendage, to prevent clots that form in there from breaking off and going to your brain. And the advantage is it keeps the patient from having to take blood thinners long term, and so they have this bleeding risk long term. And that's really where this device shines.
So with this structural heart program, you can avoid people having to deal with certain medications or live a certain life that they have a better life. And in some cases, it avoids you having to crack someone's chest open and being able to go through the groin, right? And so part of that ability to do that is this room, the technology of this room. Could you tell us a little bit about, what is all this stuff in here? What's the big technology?
So, basically this is a multi-million state-of-the-art hybrid suite. These technologies that are around now, especially in the structural heart arena, they're very low-risk procedures, but there's nothing you can do to make that risk completely gone. And if there is an issue whatsoever, the room allows for rapid care to be given from a surgical aspect. We approach everything as a team here at the Structural Heart Program for Singing River, and our surgeons are actively involved in our cases and case reviews, and they are in the room while we do these procedures, and we do the procedures together. And if there's ever an instance where there is a concern that we would have to convert into a surgical procedure, which is something that in the past would have been the only option, but now with the technology and the room that we have now, we can try a less invasive method. But if there is a concern that it has to be converted into a surgical procedure, and the patients know that this is also could be a possibility, a low risk, but a possibility. The days of waiting for equipment to come, transferring the patient, kind of being confused, the logistics are over. This room converts into an operating room, which makes it very unique in the hospital.
It's time to focus every day when it comes to heart and stroke care. So who else is offering this type of high-tech and state-of-the-art procedures here on the coast?
We are the only hospital system in the region that offers a structural heart program, and I will tell you, it is on par with the structural heart programs I was exposed to in the Long Island, New York area, Mobile, up north in Mississippi and New Orleans. And the days of needing to leave the area and get high-level care are basically over when it comes from a cardiovascular standpoint for a majority of cases. This is a huge benefit for not only the patients, but the patients' families, the logistics of people taking time off work and going into an unfamiliar place, which just puts an extra toll on already what's going on with their loved ones and the patients. And it's a fantastic service and a fantastic service line that we have here at Singing River, and I'm very proud to be a part of it.
Yeah, it sounds like it feeds right into our mission, which is improve health and save lives. And you guys are keeping people alive longer and living a higher quality life. So that's excellent. Thank you so much.
It is great. So you guys there's within the different groups that work together, there's 10 cardiologists, we have 3 heart surgeons. You guys work together. You two in Cunningham do the structural heart program, right? And it's just, it's a real blessing in our community to have this program and have you guys able to do this for us. And we appreciate what you do. I was wondering if you guys would put a recommendation to Josie to give me another chance at the stroke tech interview. Could you possibly do that?
I'll see what I can do. Yeah.
So last question is, what if someone feels like they might be a candidate for this and they need something, they're like, my family member might be a candidate. What do they do? Can they call one of your offices and you guys get them set up? How does that work?
Yeah, I think that's pretty simple. I mean, you just call either Ed's office, my office, Dr. Quintana's office, and you can be set up to be seen. Most insurances don't require a referral to a cardiologist anymore. Some do, so if you do, you need to talk to your primary care physician and get them to make you your referral. And then also the Singing River website and Facebook page have resources to point you to the right direction. There's also a structural heart coordinator here, and they can point you to her, and then she can get you referred to the various doctors in the system that do these procedures.
That's awesome. Well, again, I can't thank you guys enough for what you do and all the team of people, the real stroke techs and the nurses and the staff, and your office staff and people who work so hard to bring this to our community. It truly is a blessing to have you guys in our community, and we love you for it. So thanks a bunch.
Thanks.
Thank you.
All right. And you guys stay safe and strong.
Yep, do it.